Now, in the interest of time, we're really going to focus on the IT shops that are of real interest to us here today. The first is certainly the Office of Information and Technology, and that's still headed up by Stephen Warren. Now, there are a few folks that you're probably going to want to know about who work up here. Lorraine Lanfried, she's the head of the Office of Product Development, and Art Gonzalez, who heads up the Office of Service Delivery and Engineering, and that's the group that does a lot of the operations and maintenance of the VA's IT enterprise. But what my real goal here on this slide is to highlight that maybe this isn't the main office you want to be talking to if you're selling health IT or if you're looking for health IT within VA, with the exception of probably the Wheeler program office that you see here. Now, VA is complicated, as we all know. You've got stakeholders at multiple places within the organization, and while nominally the VA CIO is supposed to have control and oversight of the department's IT budget, in practice there are still many fiefdoms that have significant operational control of IT budgets within the department. And speaking of those other groups,
so since interoperability is our topic today, we need to discuss the Veterans Health Administration, specifically two primary groups within the VHA. Because really, when it comes to what we think of as health IT within the VA, it gets done here within the VHA. And the two groups are Information and Analytics and Quality, Safety, and Value. They're worth mentioning for two different reasons. The Information and Analytics group is where the VHA CIO, Craig Lugart, sits, and he's going to have a pretty significant role in greenlighting high-level budget requests for IT at VHA. And it's going to be key to understand that depending on your products, the VHA CIO can be important, but that a lot of your small commodity buys could happen at the VISN level. VISNs are, of course, the Veterans Integrated Service Networks, which is essentially the network of VA hospitals and clinics that provide services to veterans throughout the country. There are 21 VISNs, over 150 medical centers, and hundreds of clinics across the U.S. I also want to point to the Health Informatics Group, located right under the Assistant Deputy Undersecretary for Information and Analytics, because that's where Dr. Teresa Cullen sits. Some of you may have heard Dr. Cullen speak at some point at an event, but her group has a fairly involved role when it comes to charting the future of electronic health records and interoperability with DHA going forward. This group is going to have a fairly open ear if you can better enable mobility and data transfers between DHA and VA. Now, the other group I want to highlight is for a different reason, and that's the Assistant Deputy Undersecretary for Quality, Safety, and Value. Now, the reason we're pointing this group out is because of what's been in the news lately, and that's been all the issues and struggles with veterans' health care. We'll go into detail in the next slide, but we think it likely that this group will see some serious IT dollars in the coming years to address the troubles with patient scheduling and health care. Obviously, there's very little margin of error at the DIA when it comes to health care, and it's become clear that in certain places they've blown past that margin of error.
So when putting this briefing together, I sort of referred to this slide jokingly as VA's House on Fire slide, but maybe that's actually kind of an apt metaphor. I've kept this slide condensed and brief because, let's face it, with all the challenges going on at the VA, we probably could have spent the entire 90 minutes just talking about those problems. I think the biggest challenge facing the department right now is clearly leadership. Now, despite being removed from the problems that really plagued VA hospitals, Secretary Eric Shinseki resigned on May 30th, and he's been replaced by Acting Secretary Sloan Gibson. But what I find troubling, and what those of us here in the vendor community should really be concerned with, are the vacancies that actually exist within the IT organizations at VA, particularly within Stephen Warren's office. And in some respects, Mr. Warren himself represents a vacancy, because technically he's supposed to be the Assistant Secretary for Information and Technology, which is a Senate confirmable position. However, he's only the executive in charge of the OI&T shop. Now, there's also a lot of other top-level vacancies within this organization where some of the major product and project management groups, those positions go unfilled. And that speaks with, or to some of the challenges that VA has actually had over the years with IT project management. And hopefully they're going to start addressing those sooner rather than later. Now, of course, these problems are exemplified by the failures in Phoenix, where you had an outdated scheduling system. It was built in 1985. I don't know if everyone realizes that. I mean, it's like it's a year younger than I am. It's kind of crazy when I think about that they've, for the last 29 years, ran on a single system that hasn't been appreciably updated since then. There are going to be 2 RFPs that are going to hit the streets to replace this scheduling system. It is moving quickly. They want to award the contract. I believe they're calling it the MASS contract. They want to award that by the end of this fiscal year, so they're moving fast. There's, I think, already a draft RFP out. Keep an eye. It's all on FedBizOps. If you can't find it, feel free to shoot me an email. It'll be up here at the end, and I'm more than happy to send you to those links. So that problem with scheduling is also compounded by the fact that the VA doctors and nurses have to fill out a ton of paperwork when they see their patients. I think the stat I read is someone in a private practice can actually see about 20 patients a day. A VA doctor can see about 12 because of all the additional work that they have to do. Now, that's partly because they're not working with really modern and up-to-date healthcare systems that can actually better enable them to track that medical information. I expect that once they get the scheduling issues fixed, they're really going to try and address this paperwork issue, although Vista Evolution, which we're going to talk about in a few slides, might actually help those healthcare professionals cut down on their paperwork. So obviously technologies that can better automate clinical processes and really ensure the integrity of patient healthcare are going to be key here. And this is going to be an important angle of approach that you're going to want to keep in mind when you're approaching VA stakeholders.
So 1985 is many more years younger than I am. Thanks, Tom. Well, now that we've focused on the challenges, let's give VA a little bit of credit and talk about how hard and complex the task they're trying to achieve actually is. Illustrated here is the enterprise architecture that VA is reaching towards, and what it really represents is a holistic view of the veteran as a patient. Now think about all the data sources that come into play. Besides health data, you have billing information, pensions, loans, educational benefits. The list goes on. And a single one of these things would be a complex system in and of itself. The VA's goal, and what they've had some degree of success with, is placing all of this information in systems that can all talk to and operate with each other. You might be familiar with the Blue Button. This application enables a veteran to easily download their medical records and provide it to medical professionals. Well, that's a solid example of achievement that the VA can point to that speaks to the success of the One VA approach. The department clearly wants to avoid siloed systems that prevent different groups from accessing some information. Now, where there's an additional layer of complexity here comes, of course, from interoperability and the need to ensure data from DHA is entered properly into a myriad of systems. So that, for example, when a veteran gets activated as a reservist, his or her information gets back into the hands of the DoD.